Chapter 8, Lifespan Development. As we assess our patients, we need to understand where they are in the different growth patterns and their maturity levels. Sometimes we're spot on based on their age. Sometimes you have to adjust based on other factors in their life. But understanding the basics of where people are in their different stages of life helps us assess them as we go. So let's start with infancy, the birth to 1 year. Typically, there's not much going on at that age. They just kind of lay there, they eat, process the food, and then get rid of the food. So they're developing a little personality, but not much at that stage. Starting out 6.6 to 7.7 pounds. Colorado typically has a little bit lower birth weight, so they may be smaller than that. Weight doubles as they get older. About 6 months, they've doubled their weight size and triples by the age of 12 months. Here's an interesting fact that we need for trauma is their head is about 25% of their total body weight. So if you throw a baby up in the air, the head comes down first every time, like the old lawn darts. Airway's always really small, and that's a problem because kids pick up anything they can find and put in their mouth just to see what it looks like or what it tastes like. So that's they can choke on pretty much anything. So remember that, and since more interior, so if you bend the head back too far, then you're actually blocking the airway more. They're nose breathers. So you see little kids get a respiratory infection and get a stuffy nose. That's going to give you a lot more respiratory difficulties than an adult with a stuffy nose that can open their mouth and breathe. One thing you see moms carry around is that little bulb syringe. They can squeeze it, suck out the nose. I've always wanted to cut one of those open and do a culture of what's growing on the inside of that, because you never see them get cleaned. As the kid grows, they get the antibodies from mom during pregnancy and also through breastfeeding. So that's one of those things, if mom's healthy, the kid will get all the benefits of that. Some reflexes you need to memorize here. The Moro reflex, or the startle. When you startle a little kid, they throw their arms out, spread the fingers, and then grabs anything they can with their fingers and arms. So that's a Moro reflex. The Palmar reflex is you rub the kid's palm, they squeeze their hand around it. So you can put anything in the kid's palm, rub it, and they'll actually contract their hand around it. Rooting reflex is how they learn to eat. Anything that touches their cheek, they turn their head thinking it might be lunch. So you'll rub the edge of a kid's cheek, they'll turn around and start trying to do the sucking reflex. Anytime you get something close to the lips, they start sucking on it. So that's when you deliver a baby. One of the first things we want to do is get mom to start nursing. And the baby could be just minutes old, and the baby will have that sucking reflex, and you'll get the kid to start nursing right away, which, as we'll learn in OB, stimulates Pitocin, which stimulates contraction of the uterus, which stops the bleeding from post-delivery. So the sucking reflex is really important, both for the child and the mother. Kids sleep, or the infants sleep, 16 to 8 hours a day, but in 10-minute ranges, and they're up again. They're kind of like a dog. They sleep anytime they get a chance, and then they wake up and they're ready to go. So as they get older, they might start sleeping through the night. So the newborns are up every 2 or 3 hours. Makes a little bit of extra stress on the parents, so that's something we got to think about too. But then as they grow older, they start to get out of that. Physiologically, they have the fontanelles in the cranium. The different bones of the cranium aren't quite fused together yet. That allows the child to come through the birth canal without much damage to the skull. But as they grow, those growth plates start to grow together and fill in these fontanelles. So the posterior fontanelle closes about 2 to 3 months, and the anterior 6 to 18 months. The good thing is these fontanelles are a great assessment tool for us. If they're sunken in, it means they're low on fluid. they're a little dehydrated. If they're bulging, it means they're full of fluid or extra fluid. Could be increased intracranial pressure, could be that they're crying and they've just got an increased blood pressure. So kind of you got to assess it carefully, but look at those signs for you. If you see the bulging fontanelle, you know there's an increased pressure. Sunken means decreased pressure. Psychosocial. Kids know where their basic functions of life come from. So they know who feeds them, they know who changes their diaper. That will help them form those bonds right away. They like things to be normal. So that's that trust versus mistrust, the desire for orderly, predictable environments. As they start to want to get out of their crib, they start scaffolding. That means they're grabbing on things. That's when we start getting the simple falls and the face into the coffee table. So hopefully we're protecting those things. And then they get a little bit of anger issues build up as they grow. So that's good. They're starting to interact with their environment here. So we go up a little bit. We go to the toddler phase, that 12 to 36 months. They start drinking from water hoses. That's something we've lost in our society. I think we wouldn't have problems with COVID if we all drank from water hoses growing up. Body temperature starts to get a little bit warmer on them because they're getting more metabolism built up. So you're 98.6 to 99.6. It's important to remember that when you get a kid that you think may have a fever and they've got the 99-degree fever, that's probably normal for them. They start to gain 4.4 pounds per year. Their body starts working more efficiently. They start processing food normally. If you ever want to know how a child is progressing or how they're digesting, ask the mom. They can tell you based on the smell and content of the diaper how they're digesting their food or what kind of food the kid's been eating. So that as they get older, he processes more efficiently and they start to lose that ability there. Pulmonary system starts to mature and increase in size. You get more alveoli. At that toddler phase, the brain is about 90% of the human or the adult brain. So the kid's head's still huge. It's got a brain that's the same size. We just, as we get older, start to use more of it. And then as we get really old, we start to use less of it. So they start developing those fine motor skills. They can grab things. They can walk. They can start reacting to different things in their environment. They get more muscles as they start to walk too. So they're developing that muscle mass and strengthening the bones that are now holding their body upright. So they're going to have a little bit more protection against trauma here. Immune system, they start getting exposed to different things and start developing that immune system. We also start vaccination processes early on in life, so the kids get those wanted posters put up around so the white blood cells know what's going on. They start developing teeth and get those teeth in place by about 36 months. So you go through the teething process of the toddlers. Toilet training kind of depends on the child. 12 to 15 months. Physically, they can do it. This says 18 to 30 months. They psychologically can do it. It all depends on the kids. I've seen some that 12 months they knew what it was, and I've seen that were 18 years that didn't know what to do. So it all depends. They start understanding words and start understanding how to use their own words and understanding the words that are being said around them. They understand the cause and effect. So if I have pain, it was caused by something, and they start associating those things with the things around them. And separation anxiety. So kids know where mom and dad are, the caregivers. They get anxiety if they're separated from them. So that's something we need to be aware of when we're treating our patients. Are we pulling them away from the comfort zone? Sometimes you need to, and sometimes you want to keep that parent around so they're comfortable while you're taking care of them. They start to develop the magical thinking and play acting. It's kind of interesting because got tickets to Comic-Con next weekend, so it continues from this point on in life. They start getting language skills, start learning new words, and that's why we be careful about what we say around the little kids, because they will pick up every word you've got, kind of like a parrot. Preschool age, we're going to 3 to 5. They start learning how to get on a swing. Body continues to develop, their airway gets more mature, the tracheal rings start to form a little bit firmer, and then it gives you more protection in the airway. They start developing social skills and forming little peer groups. A great opportunity to learn more about the preschool, school age development processes. Pikes Peak Community College has a human growth development class. It's made for the medical professions out there, the nursing and the different groups out there. But it's tied in with their daycare. So you've got the daycare rooms, and then on the other side you've got classrooms where you can watch these kids interact and see the different type of social interactions going on. It's a really good class to take. Get to school age, the 6 to 12s. They've learned to ride a bike by now. Temperature, they go up a little bit. They're very active. They're gaining weight. They're starting to get taller. Teeth are falling out and permanent teeth are coming in. So they're maturing into an adult body. They're not fully adults yet. They're not there at that point yet. They're starting to get mature physically, and then socially they're starting to branch out. They're starting to learn more things around them. They start to making decisions. You want to give them the opportunity to make decisions when you're assessing them or treating them, but be very careful about the decisions you give them. Sometimes you can make a decision point which really you control both options they have. Would you like to go to the hospital in the ambulance, or would you like to sit on the cot? They start worrying about things around them, how they look. They are concerned about their clothes and their hair, and they're starting to look at how their peers are looking at them. They start developing some morals. Right and wrong starts coming into play here. So they understand what's wrong and what's right, and they're making decisions in their peer groups in their lives, trying to maintain that good character building. Adolescence, we say 12 or 13 to 18, but some go up to 28, 30 years old. Just kind of depends on the person. They start snowboarding a lot. Physiological, they start having the growth spurts. Somewhere in that 12 to 18, their body just takes off and they grow like crazy. One disease process that you might run into on physically active youth that are hitting these growth spurts is called Osgood-Schlatter's disease. It's mainly focused in the growth plate just below the knee in the tibia. It's very painful. It comes from physical activity, but it's one of those that's sometimes hard to diagnose because it's more an orthopedic issue and a growth issue, and you get a lot that severe pain. They'll typically not call an EMS, but they'll end up in the ER with these pains. They start to develop secondary sexual characteristics, breast development, hair development. This is that deciding point between pediatric CPR and adult CPR. If they start having the secondary sexual characteristics, that's when we move them to the adult CPR and adult cardiac care. Psychosocial, they want to be independent. They're not there yet. They have to be 18 to be totally independent or emancipated. Interest in sex develops. They start having experimentation. That's at this age we're starting to ask those questions. When was your last menstrual cycle? When is there any possibility you could be pregnant? Be very careful how you ask it and when you ask it, because that might change the answer you're provided. If you ask a girl if she could be pregnant in front of dad, the answer will be no. If you ask her back in the ambulance where it's quiet, it's possible. So think about where you're asking these questions. They develop a lot of concern about body image, how they look. Any face trauma is going to be devastating to an adolescent. They're concerned about how they're going to look the rest of their life. Starting to develop some self-destructive behaviors based on psychological issues they have growing up. So we've got to be aware of that and help them through those processes as we get called for their anxiety attacks and their other behaviors. And then they start ethics. So you can reason with most adolescents, play for their morals and their codes. So early adulthood, that 19 to 40, that's what most of y'all are on. You start running more. Eventually you don't. But lifelong habits are formed. You start developing these personality traits that are going to be with you the rest of your life. Your eating habits, your exercise habits. You're in your peak physical condition for the 19 to 26, and then it goes downhill from that. Psychosocial, you get careers, you start develop families, and with all those comes all the stress. So you have marriage, childbirth, child rearing, all those things leading to the stress, which increases our risk of heart disease. The number one cause of death in this early adulthood age group are accidents. They are taking a little bit risky behavior. They drive or use motor vehicles a little bit more risky, and the chances sometimes don't play out well for them. So middle adulthood, that's the 41 to 60s. You don't run anymore, but you walk. Psychosocial or physiological, you're not having many changes to your vital signs. They're about stable by now. You start needing correction of vision. These are the age group where you're getting contacts and glasses, and you're getting reading glasses. Your body's starting to have issues with processing everything that goes on, so you typically have a higher risk of cancers, cholesterol, blood pressure, heart disease. Weight control becomes an issue. And then towards the latter stages, menopause kicks in for women and changes their hormone balances. So there's a lot of changes going on in the later parts of the middle adulthood that we need to be aware of as we're assessing our patients. That'll help us understand where our patients are in life. Psychosocial, they start to focus on their career, how it's progressing out. This is the age where the children move out and the parents move in. So you start to be an empty nester, and then all of a sudden you're not, and you're taking care of your parents again. So it's a very stressful part of life here. The late adulthood, the golden years, the 61s and over. You walk, but you do it slowly, and you take a backpack in case you need a snack. Vital signs, they are all over the place based on your physical condition. So it's something we need to be aware of as we're assessing our patients, understanding where their vital signs are, and know if they're in good physical shape, their vital signs might be good. If they're having chronic conditions, they might need a little bit extra concern about their different changes in vital signs. Cardiovascular system is starting to wear down. You're getting coronary artery disease. Maybe you have a history of a heart attack here and there. You're just not circulating blood the way you used to. Years of chronic exposure to environmental toxins decreases your respiratory system. So the people that live in the cities that have a higher pollution rate are going to have damage to the alveoli just over years of exposure. Or people that have smoked chronically, you can always tell them by just the raspiness in their voice, and that's because they've damaged their vocal cords along with the alveoli. Endocrine systems change and your metabolism goes down. So there's a little bit that they don't eat as much, but they don't have the energy levels that they used to. They don't sleep well. They're up and down all night. Uh, Things just start falling apart. There's a rule of 1% that says that after 30 years of age, every year your body decreases 1% in its efficiencies. It's not always the same system. It's not all systems similar. So maybe 1% of your cardiac output changes every year, but your brain functions normally. Or your brain decreases 1% every year, and the other parts of your body work normal. But it's a combination of all these. So that can gives you an idea. By the 60s, you've lost 30% of your body function in some way. So that's why we're starting to go downhill there. Start having changes in your life. You've been a productive member of society, and now you're in the retirement phase, and you don't go to work every day. You get really you don't feel like you're producing anything. A friend of my family, they had a bakery shop, and when they retired, they stayed retired for about a year and a half, and got tired of not getting up and doing something, so they went to work. The couple went to work at a Wendy's, and the gentleman he cleaned tables during lunch. They got to work at 11 and worked till 2. He cleaned the tables in the lobby, and then his wife was the hostess in the lobby and greeted people, talked to them, and they just wanted to get out and have some fun. That's why you see the Walmart greeters that are in their 60s and 70s. They just want to talk to people and contribute back to life. So that it adds to their self-worth. Something else you might run into are people that they're making choices based on their financial instability at that age. Do you buy the medicine you need, or do you buy the food you need? Do you pay for your electric bill, or do you put gas in your car so you can go see the doctor and get the medicines you need? So there's a lot of decisions there. Know the resources in your community and how to help. But if you run across something that just doesn't make sense, show some concern and try to help them out. The other thing at this age is you start to have death and dying around you a lot. Uh, you start planning your weeks out by whose funeral you have to go to. My parents try with COVID they haven't done a lot of this, but before they would have one or two funerals a week to go to. So that's something you got to keep an eye on. If you're transporting a patient from home, think about what that's to them. They're being taken away from their home. Half their friends don't come back when they go out. They leave by ambulance. So they're really nervous, and you need to talk to them and reassure them. So any questions, write them down, bring them to class, and we will talk about them. So thank you and have a great day.